Hello, everybody, and welcome to the latest version of the VIA Live Product Training webinar series. And today we'd like to host the Kinnos team talking about the highlight. So with that, Jason, the floor is yours.
Hi, everyone. My name is Jason Kang. I'm the CEO and co-founder of Kinnos. We're a company based out of New York, USA. And I'm really excited to be here today to tell you about our new technology, Highlight, which will help prevent infections and empower your healthcare workers to disinfect surfaces correctly. So one of the biggest problems that a lot of healthcare settings face are high infection rates. Studies have shown that more than half of surfaces in healthcare settings are not properly disinfected, and this leads to a high number of infections. So for context, during the Ebola crisis, for example, 1 out of every 20 people who died was actually a healthcare worker, and even in the US, 1 out of every 25 people that stay in a hospital will get an infection that they did not start with, and this leads to tens of thousands of deaths and billions of dollars lost every single year. One of the biggest problems that we see that contribute to this high rate of infection is ineffective decontamination with human error in basic cleaning itself. So current disinfectants like bleach are transparent. You can't see where it's being applied, and you tend to miss a lot of spots. As you can see in the picture, when you apply bleach to a waterproof surface, it'll also bead up and form droplets, and you have all these gaps in coverage where nothing is really being disinfected. One of the most important parts of using a disinfectant is actually the contact time. You have to let the disinfectant sit on the surface for several minutes to make sure you've fully inactivated all the pathogens. However, there's no current method for ensuring compliance with getting people to wait those contact times. People either don't know they need to wait them, or they don't wait those times. And as a result, even if you apply disinfectant on a surface, it is not necessarily disinfected. If you've worked in a healthcare setting for a long time, you may have seen new technologies pop up in the last 5 years. You have new advanced UV light technologies, electronic misters and foggers. You have quality control technologies like ATP tests and UV powders. But all of these things are inhibited by high costs, or they require extensive training and maintenance. They can't be used for every single surface, every single time you clean. For example, you can't use an ATP swab and swab every single square inch of every single surface every time you clean. It's just not feasible. Or when you use a UV light, you can't use it when a patient's in the room, or if there's an area that's blocked by a shadow, UV light won't hit that. And most importantly, none of these new technologies replace the need for basic environmental cleaning. None of these things replace the need for someone going in there, using a disinfectant, and really wiping the surface afterwards to remove that layer of bioburden. All these new technologies are supplementary. They're combined with basic environmental cleaning to really ensure the surface has been disinfected. So the challenge that we see that technology has not addressed yet is really, how do we improve basic environmental cleaning itself using a disinfectant? And our solution is Highlight. It's an additive that's combined with existing bleach solutions at point of use to eliminate that human error. It colorizes disinfectant so you never miss a spot and you hit every single square inch of a surface. Rather than forming droplets and rolling off a surface or evaporating quickly, Highlight allows disinfectants to fully adhere and cover surfaces and maintain a long wet time. And importantly, Highlight fades from blue to clear when the contact time has been met, and this provides real-time feedback for when disinfection is done. So what does this look like? We currently have 2 sizes of the product. They both come in bottles or pouches. And you mix into your existing bleach solutions. It fully covers the surface. It's highly visible in blue, and then the color will fade from blue to clear, and that tells you when decontamination is done. And it's been used widely in epidemic response and first responder situations. This is our smaller bottle size. It's meant for those trigger sprayers you might use in a laboratory. And it's currently being used in a variety of biosafety scenarios. So both of these videos are online on the VIA Global Health website, where you can watch them again. And we really want to ground the technology in data to prove that it really does work. So this is some data that's currently being submitted for publication. And you can see that on top we have highlight mixed in with bleach, and on bottom we have just bleach with a dye alone. And you can really see that when you just have bleach alone, you're getting less than 33% surface coverage, and over time the coverage decreases because of droplets rolling off or evaporation. Whereas when you are using bleach with highlight, you really maintain that great surface coverage for a long period of time. This is a study that was done by Cleveland VA Medical Center, and basically they asked a number of healthcare workers to determine where bleach was applied on the surface 30 seconds after it had been applied. So basically bleach was sprayed, or bleach with highlight was sprayed on 5 common hospital surfaces, and then housekeepers had to, and healthcare workers had to determine where on those surfaces bleach was applied. And you can see that with bleach alone, you're getting less than 50% accuracy on most surfaces. You're basically just guessing at that point. Whereas with highlight, because it's highly visible, you can really see and accurately determine where bleach has been applied. So you have that confidence that a surface has been fully disinfected. So in terms of the product specifications, highlight is currently only compatible with bleach and chlorine. So 0.2 to 0.5% concentrations of sodium hypochlorite, calcium hypochlorite, or HTH, and NADCC, which are the most common forms of chlorine and bleach used in the field. The color is blue. We could do other colors, but right now the product is only blue. In terms of the fading time, this is something that's customizable. So depending on the use case, you can either choose to have a 3-minute fading time or a 5-minute fading time. So for example, when we were in Haiti for the cholera outbreak, they wanted a 3-minute contact time, so we did a 3-minute fade time. Or in some laboratories in the US, they want a 5-minute contact time, so we have a 5-minute fade time. So that's something that you would tell us when you are ordering. The unit sizes, so as I mentioned earlier, we have 2 sizes right now. One bottle for those trigger sprayers, or the smaller sizes are have enough powder for 650 milliliters of bleach or chlorine solution. And for the larger contractor pump sprayers, one bottle has enough powder for 5 liters to treat 5 liters of bleach or chlorine. In terms of the actual weight, the smaller bottles are 15 grams of powder, and the larger bottles are 125 grams of powder. The price is highly dependent on the volume of order, and that's something that you would determine when you start working with VIA Global. The shelf life is 3 years. We make the orders fresh. Basically, we produce them when you make an order, so you get that full 3-year shelf life. The lead time, because it is a new order, it's 1 to 2 weeks. Everything is manufactured in ISO 9001 certified facilities, made in the USA. We do recommend that the product only be used on hard, non-porous surfaces, which means any waterproof surface like plastics, metals, treated woods. If you do use it on something that is porous, like paper or dirt, the color will not fully fade. You can wash it off with water, but we recommend that you only use it on these waterproof surfaces. In terms of toxicity, we've done third-party laboratory testing, and we found that it is not an irritant, it is safe to use. And importantly, we've also demonstrated that highlight does not reduce the efficacy of bleach and chlorine itself. So on the left, you have bleach alone, on the right, you have bleach with highlight. And this was calcium hypochlorite on cholera for 3 minutes. And in both cases, you have a 6-log kill. Everything was basically killed. There's no difference between bleach alone and bleach with highlight. And we've done this test on C. difficile spores, other viruses and bacteria, to confirm that in all these cases, highlight does not change the contact time or log kill or efficacy of the bleach or chlorine solution. So in terms of example use cases, where is highlight being used right now? We've seen a lot of uses by NGOs for epidemic response and emergency stockpiling. It's been used in Liberia, Guinea, and Haiti for the Ebola and cholera outbreaks. We've seen governments use it for epidemic preparedness simulations So in Uganda, they're doing a training regimen where they're training healthcare workers to be prepared for the next, Ebola outbreak. So they're using our product for training. Laboratories are using it for biosafety trainings and cleanup. So on benchtops, fume hoods, biosafety cabinets, and so on, where they might be using dangerous pathogens for experiments. Hospitals are also using it for routine decontamination, and first responders are using it for hazmat situations where they have to transport sick patients or there's a chemical spill and so on. Some of that field testing data, we did publish a paper based off of our work in Liberia and Guinea on the Ebola outbreak, where we surveyed over 90 healthcare workers at 3 different Ebola treatment units. And we found that the vast majority of people strongly agree that Highlight greatly improves coverage. They found it very easy to use, and every single person we talked to would rather use Highlight rather than bleach alone. While we were in the field, we actually realized that Highlight has some additional benefits. So a lot of people complain that bleach and chlorine smells really bad. It irritates their eyes and their lungs. And when you use Highlight, because it's designed to better cover and adhere to surfaces, less mist actually aerosolizes when you spray it. And as a result, it's less irritating, and people have actually said it smells better. So Highlight actually makes it a safer work environment for your healthcare workers. Another really interesting thing we found is at one of these Ebola treatment units, and actually in a lot of healthcare settings, people dilute bleach themselves. They either take a concentrated powder or liquid bleach or chlorine solution and they add water to it. But a lot of times you might add too little or too much water, and then you don't get the correct concentration, which can have really negative effects, where you might not be able to kill things fast enough. So Highlight, because it's designed to fade in a very specific amount of time, it can actually tell you if you correctly prepared your bleach solution. So at one of these Ebola treatment units, they did actually half the dilution. It was half as strong as it should have been. And so it faded in 15 minutes rather than the prescribed 10 minutes or 5 minutes. And as in this way, the fading time can tell you that you quickly prepared your chlorine solution. And the last kind of anecdote and benefit that we found is that at the different Ebola treatment unit, the PPE that they were using, we determined was not actually waterproof. After they doffed and took off their PPE suit, we saw that their scrubs were colorized blue underneath. During the entire Ebola outbreak, when they didn't have a Highlight and they were just using bleach and it's transparent, they thought it was just their sweat. But it turns out that these PPE were not waterproof. And as a result, a lot of people were being infected by Ebola. So this just kind of goes to show the power of being able to visualize disinfection. So Highlight is an award-winning technology. It was a grantee and winner of the USAID Fighting Ebola Grant Challenge, which funded our field tests in Liberia and Guinea. We've won a number of other awards as well. We've gotten a lot of press coverage and testimonials. Especially important is that people feel that Highlight is safer to use than bleach alone. And just to summarize, Highlight is a very powerful tool that basically bridges the gap between simply having bleach alone and being able to use it effectively. Highlight allows you to fully cover surfaces and never miss a spot, and provides real-time visual feedback for when decontamination is done. Not only does it allow you to use a disinfectant correctly every single time you use it, but also trains your healthcare workers to really understand the importance of what you need to do to disinfect correctly. And as I mentioned, this will allow you to really disinfect correctly every single time you use a disinfectant. So we're really excited to have Highlight now on the VIA Global platform, and we think that this technology will empower your healthcare workers to really disinfect surfaces correctly and prevent infections from spreading, ultimately saving a lot of lives. Thank you.
All right, well, thank you very much, Jason, for that presentation and for all your insightful detail on that. If anyone has any questions following the webinar, please do contact us directly. Put something up on the screen just a moment from now to give you the email address and different contact details for VIA Global Health product inquiries. But before I do that, I just want to touch on the product page again, as Jason mentioned some of these during the presentation. Again, if you want to find any information about the highlight, the pictures, to request a quote, any product description or information, specifications, studies, product resources, brochures, manuals, training videos, or I guess highlight videos in general, you can find them here. Even additional ordering information is available. So always come to the product page first, but if you do have any questions, that page has just come up on the screen where you can contact us directly to request a quote, request additional information, ask any further questions. So we are always available to help however you need, whether it's through our main line, through our website, or through our local representatives in your market. But I want to thank everyone for joining wherever you may be in the world, and we look forward to you on the next VIA Live product training webinar. Thank you very much.